Hey guys, welcome to the intro towards our SNF or skilled nursing facility marketing strategies. It's going to be a series of 5 videos, and this is going to be such an important thing because a lot of our patients we can actually get from skilled nursing facilities or nursing homes, whether we're home health or a non-medical home care private duty agency, and also especially when we are a hospice company as well. So that's what we're going to be discussing in this video series. So let's go ahead and get started, right? So, for some reason, a lot of home health agencies are not wanting to market to the right places. We're just sitting in our offices thinking that referrals are just going to start coming in. Now, we just because we're listed in the Medicare listing, just because we think that we're in the phone book, just because you think that you can find us in Google, all of a sudden we're going to start getting referrals, right? One of the biggest untapped locations for referrals are skilled nursing facilities. We make objections in our head ourselves, thinking that they're already working with a home health agency and they're not going to transfer to us. Well, it is a right objection, but it is the wrong reasoning to say that we don't want to go in there. Look, if a physician has patients, then of course he needs to refer them to the proper people. Same thing for skilled nursing facilities. Now, we've made several videos regarding helping you guys getting into hospitals, getting into physicians' offices, but one great source for referrals are skilled nursing facilities, or what we call rehab facilities or nursing homes. Remember, these guys have Medicare beds. They are showing and also discharging patients almost on a weekly or even daily basis. And if that is the case, why are your agencies not taking advantage of going after to these facilities? Look, it is a lot harder to be able to get into a hospital. Why? You have to go through so many hoops, so many loopholes, so many requirements, so many different people. You're going to have to be able to be making a lot of phone calls. You're dealing with a lot of gatekeepers that's going to prevent you from getting into the right person. Plus, they also have their home health agencies that you're going to be competing against with. Now, in skilled nursing facilities or rehab facilities, some of these companies, do have their own home health agencies, but very rare has this ever happened. So you need to make sure that you do everything that you can get into that you can get referrals from. You want the hospitals, you want the doctors, and of course, you want the skilled nursing facilities as well. A lot of people say that it's hard to get into skilled nursing facilities. You're only literally dealing with about one gatekeeper that's going to prevent you from getting in touch with the right person. Now, each facility can be different, okay? There are going to be some facilities where you're going to have to go directly to the administrator. There's times where you go to the administrator and they will actually refer you to the director of nursing, okay? And sometimes they're going to ask you to then go to the discharge planner or the social worker. Either or, it's a lot easier to get into the top of the facility automatically. Now, first things first, a lot of people say, well, don't do a walk-in into a nursing home, a cold walk-in especially. Well, how are you going to get hold of them? Are you going to give them a call? Now, of course, we do have cold calling techniques that we're going to be sharing with you guys to be able to get in touch with the right people. But when we do our marketing strategies, remember, we talked about these 7 most important things that you need in marketing, but you also need to make sure that you also are calling in or you're doing cold walk-ins as well, because this ultimately, the face-to-face conversation, that personal touch that I always talk about in regards to marketing is such an important thing. And there's no different into skilled nursing facilities. I've heard them all where other consultants out there that say, do not walk in cold into these facilities. Well, you know what? If you hear that, then that person is inexperienced, because understand this. Look, you need to target every single aspect. There is no reason why that you can't walk in when you're marketing out there. You need to do everything that you can. You're going to do a cold walk-in. You're going to do a cold call. You're going to do a cold email. You're going to do a mailing. You're going to do snail mails. You're going to be sending them so much information because you want to become, once again, first in their mind, the omnipresence when it comes to services. And I guarantee you guys this, that if your agency, if you start using the programs, the formulas, the techniques and tips that I've been giving you guys, you're going to be able to make yourself more valuable than the current agency that they're currently working with. So yes, do drop in for sales meetings. When you go in, you don't have to have that meeting right away. Obviously, you want to try to maximize every effort when you go in for that first time. If you feel or you get some resistance, and I'm going to show you guys how to be able to get over those resistance, those objections. You can gather information. One part that we need to do when it comes to marketing is gathering information. The more information that you have, the more availability of you being able to be successful, from getting the right names, from being able to ask the right questions so that they can point you to who you really need to speak to. So, yes, make sure that you do a walk-in. Also, do some cold calling. Actually, I always prefer doing a cold call first to gather all the information that I need. And if you do that, you already know who the administrator is. You can gather who already is the director of nursing, the assistant DON. You can even get the information on who the discharge planner, the social worker is. It is easier for you to be able to do that when you do a cold call or when you do a first initial walk-in to gather that appointment. Yes, everyone is busy. I understand that. And yes, we are going to be bothering people. Yes, we are going to be pressuring people. Why? Because we have to be able to remove them from what they're doing right now. And I understand in the healthcare industry, everybody is doing a lot of work, but so are you. You as a marketer, you as an administrator, you as a director of nursing, you as an owner of a home care company, there's a lot of things that you're doing, but you also need to make sure that you spend some time to be able to make sure that you are getting referral sources. And this is one place that is an untapped facility. Understand also when you're going to these facilities, you're spending some time trying to get them to refer patients to you. And it goes the same exact way for them. They ultimately also have to make sure that they find the right type of agencies, the great agencies out there that's going to be able to support them and take care of their patients when they get discharged from the facility. Most of the time, they recognize the patients to the wrong agency and the agency doesn't take care of them. That's going to ultimately make them look bad as well. So always make sure that before you go into a walk-in, because it's easier to get to the top, find out who their names are automatically. Understand when you do an initial walk-in and you did not call ahead of time to gather some information, you're going to be walking in, talking into the receptionist and asking them, can I speak to the director of nursing? Or can I speak to the discharge planner? Or can I speak to the administrator? Now, imagine if you had a name already that you can drop. The moment that you walk in, you literally tell them, I would like to speak to Mr. Smith. By you saying, I would like to see Mr. Smith, or what's even better is to use their first name. Let's say their first name is John. All you have to do is say, walk in and say, hi, I'm here to see John. Most of the time, they will call John automatically. Now, if your gatekeeper kind of holds back and is professional, and a professional gatekeeper, right? Well, what are you here for? If they ask that, you're not going to start selling that gatekeeper, right? You're going to start telling them everything about your home health agency and what you do. Why? Because they don't mean anything. Why they don't mean anything? Because they're not the ones that's going to be referring patients to you. So why are you going to waste your tongue, your time, your spit? All they really want to know is who you are. So what you need to do is tell them, hey, look, I'm here to talk to John about some patients. You are there to talk to John about some patients. So by you letting them know this, they're going to contact John or Mr. Smith. From doing that, you already have a name. So before you walk in, just like anything that you do in life, you prepare yourself. You train yourself. You practice, you drill, you rehearse with these type of objections. So you want to be able to get in there. It's a lot easier. Make sure you do a cold call first to gather more information from this facility. Now, some of you guys are saying, well, Michael, I'm already getting referrals from some nursing homes. Perfect. Let me ask this question. Did you actually walk into the other 30, 40 nursing homes in your area? You guys have to understand, every week, every month, every quarter, every half a year, every 12 months, you need to be always increasing your referral sources, but also managing and making sure that you're retaining your current referral sources. So make sure that you guys do a good job and start approaching all the nursing homes that is covered in your territory. So that's the quick intro on this particular series. We're going to continue on to video 2, so please stay tuned. If you haven't yet, click subscribe to our YouTube channel and also click the notification button to notify you guys when there's new videos coming out. Once again, this is Michael with Home Health Success Academy. Marketing is easy when you know what you're doing.